Hello, I'm Vicky Gregory. I work here at Rossdale & Partners in Newmarket, an equine veterinary practice, and I'm an equine veterinary nurse. We start every day with rounds in the morning where all the vets and the nurses get together so that we're all up to date and know what's happening with each horse. You never know what's going to happen in a day. You turn up at 8 o'clock in the morning, you could have a semi-quiet day, or you can just be flat out all day and not stop at all. And you don't know when you're going to finish at the end of the day. So one of the best things about being an equine vet nurse is that you don't really have a typical day because anything can happen at any point. But we generally start at 8 o'clock in the morning and hope to finish by about 5, but obviously it just depends on what's happening. But I thought you might like to see some of the stuff that we do in a day. We're just going to take a peritoneal tap from this horse, which is a belly tap, and we get there's a cavity there where we can get fluid from, and then we'll test the fluid to see what the white blood cells are like. Just going to run this sample on the haematology machine. So I'll put in its name. Then I'll just measure its total protein. Get it to stand up on the refractometer. So the results for that, for its white blood cell, that's 0.8, so that's a good indicator. These two have had surgery, and so they're just recovering now, and we're just increasing the amount of feed they get, because once they've had surgery they go on to fluids and don't have any food for a few days, and then you have to introduce it slowly to make sure that their stomach and their intestines can cope with it. They start on picks of grass, and then they go up to little bits of hay and they have a mash. And then just get them back to normal food, and hopefully they cope with it. 564. We just weighed the horse because we're now going to give it some drugs, but you have to work out how much to give per kilogram. So we now know how much it weighs and we can calculate its drugs. This horse has got a wound on its heel, and because of where it is, it keeps opening, so we've put a cast on the horse to keep it still so that the wound can heal. I actually just saw an advert in Horse and Hound for an EVN and sent my CV round to get into a practice, and then you're trained within your practice, but you can't just go to college and do the equine veterinary nursing. You have to be within a practice to do it, and then it's a 2-year course. You don't have to have done your small animal veterinary nursing beforehand. You can just go straight into the equine side of it now, and it's a 2-year course. With going to college 1 day a week, working in practice full time and doing a portfolio alongside your college days, and then there's exams at the end of year 1 and year 2. I'm just drawing up some drugs and injecting them into these fluids to put up the horse that we saw previously. This will help hopefully to get its guts to be more motile. And you have to be careful when you're doing this to keep everything sterile, because you don't want dirt or anything getting into this, because it then goes into the horse's bloodstream. These curly giving sets reach all around the box, and also, like, if he was to lie down to go to sleep or to be rolling about and colicking in pain, then it would reach as well. This bag should go over 10 hours. We just put that bit of tape there so that the horse can't change it itself. And then turn it on there. And that's him done. We're just going into theatre now. Because it's not completely sterile, but we try to make it a very clean environment, and we use sterile equipment on the horse. So we have to just put some overalls on and change our shoes and put a hat on as well, so that we keep the area clean. This has had an anaesthetic. It's now come off the table, so it'll have had some sedative when it came off the table to try and make it sleep a bit longer. You can see we've got a head and tail rope system here. This is so that when the horse tries to get up, we can guide it up, hopefully, which will help to try and prevent it falling down again. We're just starting to wake up a little bit. You're up. Good fella. Good fella. You're up. It's all right, come on, just stand, you're all right. It can be quite scary for them having the ropes flap around. So we just try and do it as quietly and calmly as possible. Good fella, hey?